My name is Pete Diebel, and I'm on the board for the Diebel Legacy Fund. We've been through a lot of changes over the last 18 months. A lot of people have wondered how we got from where we were to where we are today. We used to be very transactional. We would go out and raise money and then we would give that money away. And when the downturn in the economy came, like a lot of foundations, we were forced to reevaluate. And what we decided was to really look inside at what we wanted to create in this world. We were doing a lot of good, but we felt we could do a lot more. So we looked for about a year, and in the end, what we realized was that what we're trying to create in the world is more doctors like Donnie, like my brother. And if that's our goal, then what do we need to do that? And what we need to do that is to look at what was important to him. So when he was in college and when he was in med school, he would go on these international medical missions and help people that had far less than we're lucky enough to have. People that would stand in line for days just to see doctors because they didn't have access to them. And then as his career progressed and he became a doctor and went out in the world and had a private practice and everything, he was doing local medical Samaritanism, as we would call it now, here in Orlando that most of us never knew about. After he died, we found out about things like a janitor at the local hospital whose child was bedridden, and he would come by each week and make sure that child was okay. And he never told anybody about it, but it was just that service that made him the doctor that he was. And we really feel that the more doctors like that in the world, the better this world will be. And so that is the main reason why we've created the Medical Samaritan program. And the Medical Samaritan program is a three-part program. For the Central Florida community, we sponsor the night clinic, which is manned by the students at the College of Medicine and their teachers, and it takes care of people who won't get health care otherwise. The working poor, the unemployed, just people who don't have any other options, and they give them great care, and as great as we can offer. The international piece is that we support partial scholarships for students at the College of Medicine to go on medical missionary work to the Dominican Republic. We don't pick up the whole bill because we feel that student should have some investment in that trip themselves, but we do pick up a portion, a big portion of it. And then the last piece is the speaker series like we experienced tonight. The importance of the speaker series is that it can't just be a doctor coming in and talking about doctor things that doctors would understand. We want them to talk about service in the communities and how we can bring medicine into our communities, and anybody off the street can come in and understand what they're talking about on some level. And so those three pieces we really think will be key to creating a very successful Medical Samaritan program, which we are very excited to be piloting here at the University of Central Florida's College of Medicine in the Medical City. And as we go, who knows where it will go. But for now, the best thing we can do is to continue to serve the communities and the people that Donnie served, and to create more doctors like him for the world.